Assalamu alaikum wa rahmatullah. On today's episode, I'm going to talk about what hypertension does to the heart. So, firstly, hypertension leads to what we call left ventricular hypertrophy. Hypertension is the most common cause of LVH in the heart. And what does LVH means? Left ventricular hypertrophy. It means the left ventricle is hypertrophied. The left ventricle is having more muscles, is becoming more muscular because of the hypertension, because of the pressure that is much in the aorta. So when this happens, usually there's a very good systolic function. The left ventricle can pump enough, it can pump very well effectively, but it cannot relax completely. Why? Because the left ventricle is a bit thickened. So if it cannot relax completely, which means enough blood is not coming into the left ventricle, and which means enough blood will not be pumped out to our vital organs, to the brain, to the kidney for systemic circulation. So after a while, this is called heart failure with preserved ejection fraction. After a while, as enough blood, more blood is still coming into the heart, because the kidney will definitely constrict some of the blood vessels so that the heart can pump more blood. It will increase the blood volume. So when the kidney increases the blood volume, which means more blood is coming into the heart, but less blood is being pumped out for systemic circulation. So when this happens, the heart itself becomes more bigger. It will become more bigger and flabby, so it cannot even pump blood enough. At a point, it cannot even pump. The systolic function will be reduced. That is when we have heart failure with reduced ejection fraction. So that is the first thing. So hypertension can lead to left ventricular hypertrophy. Hypertension can lead to heart failure, both heart failure with reduced ejection fraction, diastolic heart failure, and systolic heart failure. Furthermore, hypertension can also leads to a heart attack. How? Because we know when a patient is hypertensive, usually his blood vessels is very weak. So when the blood vessels in the heart, those are the coronary arteries. When the coronary arteries are very weak, when the coronary arteries are weak, so we have some fatty deposits in our coronary arteries. So in our blood, through our diet, some calcium, fat, and other things can deposit in our blood vessels. So when this deposit in our blood vessels, they obstruct blood flow. So when they obstruct blood flow, that is called fibrofatty plaque. That is called plaque. So when this happens in the coronary arteries, it is pathologically known as atherosclerosis. So when this atherosclerosis plaque happens, that is fibrofatty plaque lying in the lining of the lumen of our blood vessels. So when this happens in our coronary arteries, there will be obstruction of blood flow. So when there is obstruction of blood flow, which means some part of heart tissue is not getting blood at all, and it begins to die off. So when this happens, that is called heart attack. So which means hypertension can firstly lead to left ventricular hypertrophy. Hypertension can also lead to heart failure, both diastolic and systolic heart failure. Thirdly, hypertension can lead to heart attack. Fourthly, hypertension can also lead to cardiac arrhythmias, that is irregular heart rhythm. So, and at the same time, this irregular heart rhythm can in turn leads to if it happens in the atrium where we have arterial fibrillation, it can lead to clot being present in the heart. After development of clot in the left atrium, it can also lead to stroke. So in summary, hypertension can lead to left ventricular hypertrophy. It can lead to heart failure. It can also lead to arrhythmias and heart attack. But luckily enough, our doctors are fully aware. We have there is a way of regressing this left ventricular hypertrophy. So when you have hypertensive, make sure you go to your physician